So this is the video 3 in the series of the half kneeling sit back. So in the first one we went over how to set the half kneeling position. The second one was the pelvis rotation against the stable femur, and in this one we are going to go over the hip hinge, or how to train the hip flexion instead of back flexion. So again, you're just going to step forward. You're going to set the weight, that your weight is basically 50% of the weight is over this leg, so you cannot just lift it easily. Then you can just drop this hip, set the pelvis, and we are in this position. And we ended in the last time with this rotation over here. So again, this leg is staying stable, pelvis is rotating over here. Then what you are going to do is basically just shifting the hips backwards while reaching almost like with the head forward and just going back. So what you are doing is, I'll show you on this example over here. What you are doing is basically trying to get your pelvis to flex over the femur, just like this. So usually what's going to happen is when you rotate and when you try to bend like this, because there is going to be a lot of tightness in both hips, more than likely there is going to be a little bit of compensation, so you will start to rotate away from that hip and then almost like bend like this, or instead of hinging just in your hips, you're basically going to just bend the back, and there is not going to be much motion in the hips when you do that. So what you need to really do is, I'll show you from this, rotate towards that leg and then just shift into it. Also, the big thing is also to maintain the rib cage nice and down. So you're not going to do it over here, because in that case you're going to get that pinch there straight away. So keeping the ribs down, that intra-abdominal pressure, that's going to almost like act like a little bit of fulcrum, so that abdomen is going to push into the hip, creating a little bit of lever, and it's going to open up a little bit of this space. So just nice tilt, rotation towards that hip, and then you are just going down and back, down and back. I'm feeling nice stretch over here, and the leg is burning, so I cannot do it for much longer. And again, like in the previous video, if you start to get pinch even in this position straight away over there, what you can do is you can just put something on under the knee, so the angle is basically less. You are not here, it's a little bit less. And then the second one is definitely if you are in the anterior pelvic tilt, so if your pelvis is basically tucked forward, just try to keep it nice and neutral. It's going to open up the space there and give you that little bit of space. Initially, I wouldn't expect you to be able to go all the way down, depending on how much space there is in that joint. You need to find how to do it right, and then what kind of range of motion you are able to do. So initially, even just rotating, keeping this pelvis and just doing a few motions like this, it's going to give you nice workout basically in the hip. All of this is burning basically for me after the few motions. This is not a fitness exercise, so you are not trying to get sweaty or out of breath or anything. You are just teaching your body how to use that motion, how to rotate around that hip without pinching. When we can manage that, then we can start progressing it into lunges, into the stepping forward and few different motions. But this should be really subtle movement, and that's actually why it is actually quite challenging for most people to get it, because it's hard to feel it. You need to have pretty good body awareness, or you need to do it in front of mirror, like almost like a ballet dancer, and just practicing this motion to get it right, so you can do it in the pitch or during your event, just like that, no problem. Guys, any question, just let me know in the comments down below. And the next one, we'll just go over a little bit of troubleshooting, maybe with the band, how to do it when that pinching is actually quite bad. Okay guys, good luck.